Well, hello and welcome back to the Center for Digital Health Research podcast. I'm your host, Pierre Ducharme Gauthier. Throughout our episodes, we discuss novel, transformative research in the realm of digital health, chat with an expert in a related field, or introduce you to useful online platforms and technologies to keep an eye on. Today's special guest is Dr. Vedat Verter, PhD. Dr. Verter is a professor and the Stephen J. R. Smith Chair of Management Analytics at the Queen's University Smith School of Business. Today, he's here to talk to us a little bit about remote patient monitoring technologies. Yeah. Hi, Dr. Verter. How are you?
Hi, Pierre. Happy to be here.
Wonderful.
Thank
We're
you.
so happy to have you. Well, I'll get kind of right into it. First of all, what is remote patient monitoring or RPM?
So, remote patient monitoring is a fast developing technology that enables care providers to keep an eye, if you will, on their patients when the patients are in their own residences. And so it is basically comprised of a wearable device kit, which might include a number of different devices, for example, something to measure your blood oxygen level or something to measure your blood pressure. So there's a hardware component to it. That hardware talks to the software that is installed at the patient's home,
Okay.
and through internet that software from patient's home transfers or uploads, I would say, the observations or measurements that the patient provides to the hospital or the primary care provider. So this means that the patient continue residing in their home or any other type of residence without the necessity of being, for example, at the hospital. And still, a nurse can follow their physiological markers.
Mhm. So they could definitely have it kind of and it'd be far away from the hospitals. You don't necessarily need to be in the same city either, from my understanding.
Well, you don't necessarily have to be in the same city. The technology doesn't require that. But at the same time, basically, when and if there's a deterioration in the patient's condition, the nursing team basically escalates the situation to a physician, and the decision could be made for the patient to come to the hospital. And so, therefore, the remote patient monitoring is not there to eliminate the need to come to the hospital. So, it would be an issue if the patient wasn't in the same city. But nevertheless, from a technology perspective, it doesn't require, I mean, because all the transmission is done through the internet, there's no need for the patient to be in the close proximity of the hospital, let's say.
Mhm. That's great. Um, what current issues currently in healthcare does remote patient monitoring tackle specifically?
So one of the primary issues it tackles, from the projects that, I have been involved myself in Kingston, is what we call the alternative level of care patients.
Mhm.
Alternative level of care basically means that the hospital has done the best they can in terms of stabilizing the patient and the patient's acute care needs, and therefore the reason for the patient to be at the hospital have been minimized at that point. But there may be several reasons as to why the physicians may not feel comfortable sending the patient home. One of these may be that the patient may not have the necessary support system at home. The patient
Mm.
may be living by themselves, and therefore the physician can may be concerned that if something deteriorates, the patient may not have easy access, to the hospital. Or secondly, the physician may find it necessary to observe the patient a little bit longer, although the need for acute care in the hospital is not that excessive. So typically, these type of patients are called alternative level of care patients, meaning that they need a different level of care than acute care or hospital care. Conventionally, these patients have been kept in the hospitals for longer stays and occupied patient beds. And so the remote patient monitoring systems and the care provision that comes with it um, uh, enables the hospitals to discharge such patients and empty hospital beds, and so therefore admit new patients who have been waiting for those beds. So it actually, remote patient monitoring systems actually play a significant role in dealing with the congestion in our health system.
Wonderful. Yeah, so ultimately, more patients are able to get seen and get their care a little bit quicker with
That's
remote
the
patient.
idea. Yeah.
Wonderful. Are there, thinking of remote patient monitoring technologies, what are additional benefits or other potential applications for them within kind of the healthcare system or beyond?
So particular, I'm more familiar with the healthcare applications, and in healthcare they have been used for for example monitoring high blood pressure patients, diabetic patients, uh, heart disease patients, patients after surgical procedures, and patients having chronic lung disease. So there are lots of applications in the health care domain, and of course, each application uh, uh, requires a specific device kit, specific combination that serves the purposes of what physiological markers that you wanna follow. Uh, for elderly patients, for example, I'm familiar with remote patient monitoring technology that particularly focuses on falls. As you might know, in elderly patients, falls are scary in terms of recovery and etc. There have been pendants developed that the patient can wear like a necklace, and if there's a sudden fall, the pendant will sense it and inform the call center, and then the patient can also use the pendant as a communication device with the call agent, and if necessary, the call agent would send a care provider to the patient's home. So that is intended to prevent situations where the patient falls and hours there's no one to help out. So that kind of gives a quick and easy access to some call center for the patient.
Absolutely. That's wonderful. Um,
Meaning at all times. That's the key.
mhm,
Access at all times.
absolutely. No, I think that's really great because especially if somebody is wanting to live alone, it is a way for them to kind of be kept track of without a worry that if they fall, that they'll be alone until somebody comes and visits instead of knowing that they have a
And I
device.
guess I should be clear, um, on the privacy side,
Mhm.
that what you are keeping track on is the patient's physiological markers, like, for example, blood pressure or pulse rate. You're not recording video in the patient's home.
Mhm.
So, you don't have that unfettered access to whatever the patient is doing and the patient's privacy. It's more like through some biological measurements. From there, of course, there are algorithms to decide whether there's something wrong or not, or etc. So that's where we come in terms of how do you process those real-time data
Mhm.
to decide whether there is a deterioration or an increase in some risk for the patient that a call agent needs to intervene.
Absolutely. Beyond knowing that kind of they do have these necessary, why should patients agree to use RPM technologies?
Well, that it allows um, the so the conventional wisdom is that everybody prefers the patients to be at their homes, meaning the patients themselves as well as the care providers, to the extent that it's feasible, and this technology makes it feasible. It kind of pushes the envelope of those feasible conditions and extends those conditions to people living alone, elderly people, and etc. To give them the ability to be at their homes, to be living at their homes, and then having access to the care providers. Now, one other note that I would make is that, of course, when you are part of a remote patient monitoring program, that means you have access to a remote patient monitoring care team, right? It's not just the hardware devices. It comes with all the care attached to it. And what that means is that if they decide that your situation needs to be escalated and you need to come to the hospital, you may not necessarily have to go and present at the emergency department and wait for 4 hours to see a doctor. You may actually be invited to the hospital to directly see your own physician. So in addition to, increasing the likelihood of being at home, I believe these type of programs also provide access to the patient's own physician a lot easier.
Mhm. No, that's wonderful. So everybody has a lifeline essentially when using remote patient monitoring technology. It really is just beyond the technology. You have somebody there who's looking at the information, ready to care for you if something were to kind of indicate.
And the type of work we do, because you might wonder where, academics in, management analytics or in the business school, come into the picture in this scenario. I mean, the place where we come into the picture is that there is a continuous set of signals coming from the patient in terms of their biological markers. You have a remote patient monitoring nurse who is in charge of keeping an eye on, let's say, 100 patients that is on the program, and so therefore, there's a step in between where we process that data and try to come up with risk assessments to flag the nurse in terms of where their attention should be. It's impossible for someone to look at 100, 200 files all at the same time. So that's where we come in. We come in with the risk assessments and the rules pertaining to how the care provision should proceed.
Absolutely. And then so for the way that you kind of just explained, would that also be then informed by current research or current kind of our best practice in terms of, let's say for blood pressure, what would be kind of seen as safe
Absolutely, of
today?
course. We don't make those clinical rules. We are given those clinical rules by the physician or physicians in charge of that particular program, whether it's a program for cardiac surgery patients or a program for fall management for elderly. They would develop their own clinical rules, and we implement them in the context of a machine learning or artificial intelligence framework to pinpoint among a not so small population where the attention of the nurse should be.
Mhm. Absolutely. Thinking of our PM technology, are there any risks involved that patients should be aware of?
So yes, there are. I mean, as all new technologies, including artificial intelligence, which is the technology of the day, there are benefits and there are associated risks. And one of the risks is that, of course, these devices are not 100% accurate in terms of their measurements, because those measurements not only depends on the device, but also depends on how the patient uses the device.
Mm.
So therefore, some of these measurements that are uploaded by the patient may be a result of faulty measurements And so, one of the risks they're running is that the medical decisions concerning their health would be, would be informed by those faulty measurements. But again, this is where data analytics come into the picture, and we try to sort of sort out, the clean data versus the noisy data. As an example, and this is a true example which stayed with me, that at some point the patient, it looked like the patient had lost an incredible amount of weight from the remote weight sensing scale. The care team were not able to make any sense of it. And then after some digging, it became apparent that actually the patient's cat decided to use the scale as its own bed. So therefore, the patient was as heavy as a cat, for a while. And of course, the care provision team were going crazy. This is an extreme example. But it tells you that there are risks about the health of that data, and also the other set of risk is the what we call the alarm fatigue. If the remote patient monitoring system is set at very strict alarm levels, it may, alarm the care provider team too frequently about the patient, and sometimes unnecessarily. And in those cases, what we call the alarm fatigue may happen, that these alarms may not be taken seriously by the care provider. So all this is to say is that having an efficient or effective RPM system in place goes way beyond providing the patient with the right device kit, educating the patient about how to use it, making sure that the setup is done correctly, and etc. So it's sort of a whole bunch of different steps needs to be synchronized to work in a seamless fashion, so that the whole system it's actually a sort of a system that is working by means of its parts. And I would say, of course, I should mention risks about equity, in the sense that we do know that not every patient has access to internet in their home, and not every patient is computer savvy, and et cetera, et cetera. So when you design a system that dwells on this technology to monitor your patients, you may inadvertently excluding some of your patients on the elderly side or on the equity-seeking group side. These are not unsurmountable risks. We all work on hedging them, but it's important to be aware of them.
Yeah, absolutely. Kind of going back through what you've been talking about. So, from my understanding, there will be potential false negatives or false positives. Could be a chance depending on kind of if there's something going wrong with the technology. But overall, because it's being monitored, typically you should be able to tell
Yes.
when something's gone awry. So if something really looks like it's not how it was before, you're able to say, hey, potentially there's something else kind of causing it to change there.
Yes. Yes. So you have to couple that technology with additional decision support
Mhm.
tools to make better sense of the data that the technology is providing.
Yeah, absolutely. Wonderful. Are there any misconceptions with RPM technology that have kind of become clear throughout working? Or...
Uh, so uh, there are a few that I can think of. One is this idea that this technology is going to eliminate the need to go to the emergency department. That's not the case. Of course, the intention is to reduce those needs, but at the end of the day, um, a physician may need to see the patient in person, and so therefore, it's not eliminating the emergency department visits, but it's more reducing them. The other sort of misperception is about how difficult it is to use these systems, and once the setup is done properly, um, it's not very different than the patient taking their own weight or taking their blood pressure and etc. So it's not um, more difficult than doing all those things in a unconnected way to the hospital. I mean, we all take blood pressure at home, or we measure our weight and etc. So these are things that we already do at home. What this technology enables is, to connect those measurements in a structured way to the hospital, so that the care providers, can keep an eye on you. I already talked about the accuracy issues. I mean, there is also a misperception that these technologies are perfectly accurate, and of course they're not. It's a work in progress. And maybe I should also mention that there might be a misperception that these technologies are geared more towards use by elderly patients. It is true that elderly patients is a significant population among the RPM users, but it is not true that this is targeted towards that population. I mean, everyone may have a need. You can have chronic lung disease, at an earlier age, and if that is the case, you may benefit from using RPM technology.
Wonderful. Um, with your experience, how have both clinicians and patients responded to RPM technologies? Do they mainly regard it as positive or negative, or really enjoying kind of the effects and being able to be home?
So my anecdotal experience is that both the patients and the physicians actually appreciate the technology in general terms. The physicians appreciate the technology because it makes their life easier to keep track of their patients, as well as opening hospital beds, which is a way to sidestep congestion in the wards that they work. And patients, appreciate because it gives them, it's called connected health, right? So it connects them to their care providers. Um, I think, there are issues about, trust on the technology, as we see in many other evolving technologies. And I think the patients feel uh, more trust to the technology when this technology is coupled with strong provider communication. In other words, even if the RPM kit would upload new measurements every day about the patient, the best practice is for the nurse to actually call the patient and have a conversation with the patient, either on an audio call or a video call, some digital telecommunication mean, to have a personal touch in terms of the care provision, and that is, to the best of my knowledge, the most ideal scenario for the patients. They don't want to be completely confined to the RPM technology. They want to see that technology being used by care providers and have strong communication with the care providers during the process.
Wonderful. I know we talked a little bit about equity as well earlier as a potential risk. Um, but can RPM technologies be used for northern, rural, or remote communities? And have those communities already been potentially impacted with RPM technologies? If we've seen benefits?
The short answer is yes, absolutely, and this is one of the areas where such technology, could be very beneficial in terms of providing care access to communities where access has not been um, seamless. Notwithstanding the fact that in the event that you use such technologies in northern or highly rural communities, you may have to supplement or strengthen the digital communication structure in those communities to be able to use this. But it is known that telemedicine has helped such communities, meaning you'll have a resident nurse in the community, but that nurse will have access to primary care providers and specialists to provide care to the individuals in that community. So this RPM is one or two steps beyond that. It could be viewed as yet another phase in the journey of providing telehealth to less connected populations.
Wonderful. That's wonderful. Is there anything else or any last thoughts that you'd like to share about RPM technologies?
Well, I wanted to say a couple of words about sort of the one of the projects that's near and dear to my heart in terms of making progress in this area, where we work with the Kingston General Hospital, where the project is called Virtual Recovery After Surgery, which is focused on cardiac surgery patients. So basically, these patients, upon the completion of their cardiac surgery, at the time they're discharged from the hospital, they're provided with a kit that they normally keep for 14 days. So they're told to send measurements twice a day, every day. And then the nurse is scheduled to call them at certain days, for example, day 1, day 3, day 7, day 10, and day 14. And so this gives us a quite good understanding of where the patient is. In addition, the patient is instructed to upload a picture of their surgical wound at the beginning and at the end of this 14-day period. So in this context, we have been developing a risk assessment tool where we identified the predictors of risk of emergency department visits or rehospitalization within 30 days of discharge. So if we identify those factors, then we can trace those factors and then inform the care team about those patients who have surpassed a certain risk threshold. Those risk thresholds, again, as you have asked me before, are provided to us. It's the surgeon's call to decide what those risk thresholds are. But what we bring to the table is an ability to see whether a patient actually is below or above that risk threshold so that the care provision team should do something about preventing a preventable emergency department visit or a preventable rehospitalization.
That's great to hear. It's fun to hear about the current projects and knowing how remote patient monitoring is kind of being used at the moment. It is kind of having a positive impact on the healthcare system already, and I assume will continue to kind of have more and more of an impact as time goes on and as more technologies become available to the public and to patients.
Mhm.
Yeah. Well, that was everything on my end. Thank you very much for taking the time to be here and talk to us about remote patient monitoring. It was really interesting to find out more and kind of feel confident that it is something to kind of be trustworthy of and to try out. I assume there's always the option as well. If it doesn't work out for someone, um, they're not forced to have it potentially. So
Yeah.
it's all about patient preference too. So.
Yeah. Well, thank you very much for the opportunity.
Yes, of course. Thank you. Well, hopefully we'll catch some of you listeners next time as well with another episode of the Center Digital Health Research Podcast, and we'll see you next time. Thank you very much.